Hello everyone. In this video, I will be sharing another 3 new drug approvals by the US FDA from late September 2025. All these 3 new drugs are small molecule oral agents. Specifically, Inluriyo has been approved for the treatment for breast cancer. Palsonify has been approved for the treatment for acromegaly. And Rhapsido has been approved for the treatment for chronic spontaneous urticaria. Now, let's dive into each medication in more detail. Imlunestrant, brand name, Inluriyo. This medication was approved by the US FDA on September 25, 2025, and indicated for the treatment for adults with ER-positive, HER2-negative, ESR1 mutated advanced or metastatic breast cancer. ER positive refer to estrogen receptor positive. HER2 negative refers to human epidermal growth factor receptor 2 negative. ESR1 mutation refer to the mutation related to estrogen receptor. This is an oral small molecule with azitidine and tetracyclic benzopyranol quinoline motifs. The molecular weight for this medication is 524.5 gram per mole. Hydrogen bond acceptor 5. Hydrogen bond acceptor refer to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor 1. Hydrogen bond donor refer to the number of hydroxy and NH groups within the drug molecule. Log P, that's the parameter for lipophilicity. The higher log P, the more lipophilic. The log P is 5.99, which is a pre-lipophilic molecule. Polar surface area 55 square angstrom. In addition, given the drug molecule contains the azitidine motif, has the tertiary imine motif, so therefore this medication is available at the salt form with toluene sulfuric acid, tosylate. Mechanistically, this medication works as an estrogen receptor antagonist. So you can see based on the drug name ending with estrant. So you can see estrogen and antagonist. So therefore, this medication works as an estrogen receptor antagonist while inducing degradation of estrogen receptor alpha and subsequent inhibition of ER-dependent gene transcription and cellular proliferation in ER-positive breast cancer cells. Currently, some other estrogen receptor medications include elancastrant, which has been approved in 2023 for the same indication. The older estrogen receptor antagonist, fulvestrant, which has been approved by the US FDA in 2002 for the treatment for breast cancer. Pharmacokinetically, Tmax, that's the time to reach the maximal drug concentration, about 4 hours. Oral bioavailability, you can see is relatively low, about 10%, given the molecular weight is over 500 along very lipophilic drug molecule, log P is about 6. So therefore you can see that oral bioavailability is pretty low, 10%. Volume of distribution is very large. Given this drug molecule is a very lipophilic drug molecule, which has a very large volume of distribution, 8,120 liters. Protein binding is greater than 99%. Half-life 30 hours. So you can see this medication has a long half-life. So therefore you can see the dosing, that's the once daily dosing. Metabolism. This medication will be metabolized by the CYP3A enzyme along with the phase 2 conjugation pathway with the sulfates and the glucuric acid. Excretion in the urine about 0.3%, In the feces, 97%, but 62% as a parent drug molecule. Drug-drug interactions. Given this medication is metabolized by CYP3A enzyme, so you can see for patients, if they take strong CYP3A inhibitors, for example, itraconazole, the antifungal agents, clarithromycin, antibiotics, and this would lead to increased drug exposure for imlunestrant. In a similar context, for patients, if they take Inluriyo with strong CYP3A inducers, so for example, rifampin, or with carbamazepine, so the anticonvulsant agents, this would decrease the drug exposure for imlunestrant. Therefore, in both cases, I need to avoid concomitant use. If unavoidable, so make sure to adjust Inluriyo dose accordingly. Specifically for patients, if they take a strong CYP3 inhibitors, need to lower the dose for Inluriyo. For patients, if they take a strong CYP3 inducers, given the lowered drug exposure for imlunestrant, so you have to increase the Inluriyo, the dosing. Currently, there are no contraindications listed on the prescribing information. Adverse effects greater than or equal to 10% musculoskeletal pain, fatigue, diarrhea, constipation, abdominal pain. Paltusotine, brand name Palsonify. This medication was approved by the US FDA on September 25, 2025, and indicated for the treatment for adults with acromegaly. This is a small molecule oral agent with piperidine, so the basic motif along with the primary imine, as well as quinoline, which is the bicyclic heterocyclic motif highlighted in red. The molecular weight for this medication is 456.5 gram per mole, 100 bond acceptor 5, 100 bond donor 3, log P 4.5. So you can see this is a pretty lipophilic drug molecule. Polar surface area 86 square angstrom. Given this is a basic drug molecule, so you can see this medication is available as a solid form with hydrochloride. Mechanistically, this medication works as a somatostatin receptor agonist. So therefore, this would suppress growth hormone GH and the insulin-like growth factor 1, RGF1 secretion. In addition, this medication is available as 20 milligram or 30 milligram tablets. So therefore, you can see the recommended dosage. The initial starting dose is a 40 milligram taken orally once daily with water on an empty stomach at least 6 hours after a meal or at least 1 hour before the next meal. If needed, lower the dose accordingly to 20 milligram. After 2 to 4 weeks, titrate to 60 milligram once daily based on this insulin-like growth factor 1, RGF1 levels. Pharmacokinetically, Tmax, that's the time to reach the maximal drug concentration, 1 to 4 hours. Volume of distribution is 220 liter. Protein binding, 99%. Half-life, 28 hours. So pretty long half-life. So you can see, so that's why this medication is taken once daily dosing. Metabolism. Given the presence of phenyl hydroxy along with the primary imine motif, so this medication you can see can go through the phase 2 conjugation metabolism with glucuronic acid, specifically UGT1A1 or 1A9 enzyme. In addition, this medication can be metabolized by CYP3A4, CYP3A5, and 2D6 enzymes. Excretion in the urine about 3.9%, in the feces 90%, but mostly as a parent drug molecule. Drug-drug interactions. Given this medication is metabolized by CYP3A enzymes, you can see for patients if they take Palsonify with other strong or moderate CYP3A inducers, because the inducers will lower the drug exposure for Palsonify, so therefore may require some dosage adjustment. So specifically, if patients take strong CYP3A inducers, because this would lower the drug exposure for paltusotine, so therefore you need to increase the dose accordingly. For patients, if they take a Palsonify together with the PPI, that's the proton pump inhibitors, may require some dosage adjustment accordingly. The reason for that, if you look at the chemical structure for paltusotine, this is a basic drug molecule and has a pH-dependent solubility profile, which means in more acidic environments, this medication will dissolve faster and lead to higher absorption. So therefore, for patients, if they take this medication together with the PPI, because PPI will increase the pH value, so therefore this would lead to decreased solubility and decreased absorption for paltusotine. So therefore, this may increase the dose accordingly. So in addition, if for patients take a Palsonify together with cyclosporine, and so this can lead to decreased drug exposure for cyclosporine, which is immune suppressant. This may require some dosage adjustment accordingly for cyclosporine. Currently, there are no contraindications listed on the prescribing information. Adverse effects greater than or equal to 5%, diarrhea, abdominal pain, nausea, decreased appetite, sinus bradycardia, hyperglycemia, palpitations, gastroenteritis. Remibrutinib, brand name Rhapsido. This medication was approved by the US FDA on September 30th, 2025, and indicated for the treatment for chronic spontaneous urticaria, CSU, in adult patients following H1 antihistamine therapy. This is a oral small molecule agent with pyrimidine methylpropylenamide. So that's Michael acceptor, giving the double bonds electron withdrawing effect from carbonyl, as well as cyclopropyl motifs, which is highlighted in pink here. This medication is available as a 25 mg tablet. The recommended dosage 25 mg taken orally twice daily with food or without food. As mentioned, this is a small molecule. Molecule weight is 507.54 gram per mole. Hydrogen bond acceptor 8, hydrogen bond donor 3, log B 3.29. Polar surface area is 110 square angstrom. Mechanistically, this medication works as a small molecule kinase inhibitor targeting Bruton's tyrosine kinase, BTK, and other kinase as well. This would block the release of histamine and other pro-inflammatory mediator in the downstream pathway. Mechanistically, so this medication works as a small molecule kinase inhibitor specifically targeting Bruton's tyrosine kinase. So therefore, you can see based on the drug name ending with brutinib, reflecting this is the inhibitor for Bruton's tyrosine kinase inhibitor. Pharmacokinetically, Tmax about 1 hour. That's the time to reach the maximal drug concentration in the plasma. Volume of distribution at steady state 1,238 liter. Very large volume of distribution. So given this is a very lipophilic drug molecule, log P is about 3.3. Protein binding, 95.4% metabolism. This medication will be metabolized by CYP3A enzyme. So that's the major metabolic pathway. Half-life is 1 to 2 hours, which means a pretty short half-life for this medication. But on the other hand, because this medication drug molecule contains this macroreceptor, so therefore the inhibition mechanism will be irreversible covalent bond with the proton tyrosine kinase. So therefore this can lead to the prolonged duration of action, justifying the twice daily dosing. Excretion profile in the urine 30%, but 2.9% as a parent drug molecule. In the feces 70% as the majority of the metabolites. Drug-drug interactions. Given this medication is metabolized by CYP3A4 enzyme, so you can see for patients if they take Rhapsido along with strong or moderate CYP3A4 inhibitors or inducers, avoid concomitant use, because the CYP3A4 inhibitors would increase the drug exposure for Rhapsido. In a similar context, the CYP3A4 inducers will decrease the drug exposure for Rhapsido, which can lead to decreased efficacy. So therefore, in both scenarios, need to avoid concomitant use. For patients, if they take Rhapsido together with P-glycoprotein substrates, for example, digoxin, that's the heart failure medication, and so this can lead to increased exposure for P-glycoprotein substrates. So for example, the digoxin, and the reason for that is because remibrutinib is a P-glycoprotein inhibitor. In addition, for patients, if they take Rhapsido together with antithrombotic agents, make sure to monitor closely and consider associated risk and benefits. Currently, there are no contraindications on the prescribing information. Adverse effects greater than or equal to 3%, nasopharyngitis, bleeding, headache, nausea, abdominal pain. These are the major references which I have used to prepare for today's video. The FDA new drug approval for 2025 is a very valuable resource. In addition, most of the medication information which are shared today are based on Inluriyo, Palsonify, Rhapsido prescribing information. And all these documents are available at the US FDA website along with the drug manufacturer website as well. Finally, I want to thank you all so much for watching. If you enjoyed the video, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.